Let's talk now to Dr. Layla McCay, who's my first guest today. She's director at the NHS Confederation and joins us once again. Good morning, Layla.
Morning, Gillian.
Lovely to speak to you. There is an awful lot to talk about, related very much to kids going back to school. I mean, we've seen these reports about parents being worried about kids going back to school and the risks. And the Public Health England report that's been leaked to the Times suggests that older pupils, the closer you get to adulthood, the more likely it is your body acts as an adult's body would, and you're more likely to catch the virus, and more likely to get ill with the virus, and more likely to be able to pass that virus on. Is it a very big concern within the NHS Confederation? You represent NHS Trust that when schools go back in September, there will be a few weeks later a big rush of people getting seriously ill and ending up in hospital? Because we haven't seen that in any other country where they've returned the kids to school.
I mean, it's clearly possible, but we don't really know. At the end of the day, there's a range of things, of which returning to school is one, that could increase the risk of transmission of coronavirus and move us towards more cases. But we don't exactly know. Certainly, we've seen other countries have quite a mixed view. In many cases, there hasn't been a spike. In some cases, just one or two children have caused quite significant little outbreaks. So it's a question that we don't really know the answer to, and clearly there needs to be some kind of balance, because getting kids back to school is, of course, also really important. Yeah,
I mean, that's the thing. And again, it's about the balance of risks, isn't it? I mean, that is the absolutely crucial thing there. Let's also talk about the balance of risk related to test and trace, because this is absolutely very crucial. The government is apparently looking at moving away from this Serco-run national centralised system that's cost huge sums of money. Getting people on the phone, calling people to say to them, you've tested positive, or you've been in contact with somebody who's tested positive, and can we have your contacts, etc., etc. They've tracked and traced, frankly, just simply nowhere near as many people as they need to, and it's getting worse rather than better. And there's now going to be a move from the government to move towards cutting those centralised staff and replacing them with local council teams, local public health teams, using local knowledge, not just making those calls, but knocking on doors. I mean, I have to say, this is what a lot of local health providers and local councils have been saying they wanted all along. Would you welcome that?
Yes, we would. That's absolutely right. Ever since the beginning of discussions about test and trace, we've heard from our members that the local approach is the more effective approach. People know their populations, they know their geographies, they know the so-called human geographies, and that makes it so much easier for them to target their approach and find the people. And we've seen the results, which have been that the local teams have had a higher amount of success in tracking people. That said, of course, there was a place for this national team with just the scale that we were talking here. It wasn't like local authorities had this massive amount of people in reserve ready for this. So clearly this support of having all these additional contact tracers has been really important. But now I think if we are going to make sure we do contain the virus and get the proper value from test and trace, we are actually going to have to make sure that we're tracking as many people as we possibly can. And it looks like this is a really good move towards achieving that.
Yeah, I mean, that's the crucial thing. And again, we know the issue is an awful lot of the times that people simply aren't answering the phone. They don't have the numbers of people, they're not reaching them, or they do have the number, they call them, it's an 0300 number. People think, oh, it's just someone trying to sell me something. They don't bother answering the call. They don't leave a message. There's no number to call back on. I mean, this is such basic stuff. It sort of defies belief that it's been done on such a bad basis. Let's talk there. I mean, we know we need that to be running very well for us to get schools safely back. But we also know there is a big concern about this talk about second wave, about the winter crisis that the NHS goes through every year, having been in crisis for much of the last year already. There's a plan now for drive-through flu vaccination centres to be set up for everybody. And I know I'm 52, so I'm eligible for that as an over 50. But people are going to be asked to go get the jabs in their GP's car parks as part of these preparations for the NHS. I mean, is that part of the answer?
It's hard to say. Our primary care members have been telling us that, they really support this increase in flu vaccination, but it's quite the logistical challenge. This is vast numbers, and there are going to have to be solutions that are brought in. But what they've been telling us is we really need to make sure people aren't just getting the jab and those records are not getting back to their GPs. Everything needs to be really nicely joined up for the safety of patients and to make sure that that we're all getting the very best of care. So I think that's the primary concern, but certainly innovation is quite possibly going to be needed.
Yeah, indeed. I wonder after the long process for setting up the testing centres, coronavirus, whether they will be in place. But again, maybe that's given the government some experience, and that will be the answer. But that's going to be really crucial, isn't it? Especially given that flu symptoms can often be very similar to coronavirus symptoms in the early days. That actually, making sure as many people as possible get a flu jab, that will be crucial for the NHS's ability to cope if we do get a second wave. And again, it is still an if.
That's absolutely right. It's all about trying to manage the risk so that hopefully things will be all right. We know there's a risk that there could be a vast number of cases of coronavirus. There could also be a vast number of cases of flu, and that in many ways depends upon some of the decisions that we make in terms of getting flu jabs, in terms of taking social distancing precautions, etc. There's all sorts of different variables at play here, and all we can really do is try to reduce the risk, and hopefully that will see results.
Let's keep our fingers crossed. Dr. Layla McCay, thank you very much indeed.